Hello there, this is Dr. Bob Johnson with another interview with a very, very wonderful practitioner I've known for a number of years by name of Tom Groover. And Dr. Groover is a chiropractor from Boulder, Colorado, who has a unique series of skills and talents that he'll tell you more about and that we're going to talk about that I think are going to be very important to understand for our audience. So welcome, Dr. Groover.
Thank you, Dr. Johnson.
I look forward to hearing more about what you're doing with trauma and really how to clear this with people. But first, tell us a little bit about you and your background and how you came to do what you do.
Yes, I've been involved in trauma and stress indirectly all my life. Years and years ago, 1974, I became a teacher of Transcendental Meditation, which is a procedure for expanding the conscious thinking capacity of the mind and for experiencing the really depths of one's being. And in the process, we utilize that procedure for managing stress for many, many people, and including ourselves. And then I became interested in health and did some nutrition work with a friend of yours over in Ellicott City, Dr. Gene Sambatero. And that's when I met you, back in the mid-'80s, I guess it was. And then I went away to chiropractic college because I had been practicing. I was a massage therapist in the Washington, D.C. area and yoga therapist, practiced Ayurveda, and decided I wanted to be a chiropractor and get a license keep myself out of trouble. So I went away to chiropractic college at Palmer College in Davenport, Iowa, and graduated there and with some specialties and set up a practice in Boulder, Colorado. And I've been here since 1999. And right now we have quite a expansive protocol, which includes the correction of the upper cervical spine very specifically, and the working with all the joints of the pelvis, the spine, all the extremity joints, and clearing those from traumas that people will know they have because they have pain or stiffness, but a lot of times, we find things that are not really recognized by the patient that are really holding them back, really subjecting them to physical limitation, mental limitation, and putting them at risk for injury.
So when you speak about traumas, you're not just talking about physical traumas, but you're talking about a whole spectrum of traumas that affect us day to day. Tell me a little bit more about these different traumas that you deal with.
Yes, we're used to the physical trauma part of life. Most of us have grown up and learned to ride a bicycle and fell over onto the sidewalk or ran into a tree or a real estate sign or something like that. Many of us have played sports and had stingers and sprains and strains and fractures. Many of us have been in car accidents. And when that happens, what we find is that the entire body is traumatized. Just about everything imaginable happens to people when that occurs. So those are strong physical traumas, light physical traumas. You can fall down the stairs, you can slip on the ice, you can, fall, keep snowboarding. There's different ways these things can happen, but the point that I want to make here is that you can't really separate the mind and body. When you get hit, there's a mental experience too. And that mental experience is quite intense. In fact, to a large extent, these bigger traumas are larger than we have the ordinary capacity to recover mentally and emotionally. And so those traumas get stored in our operating system of our mind and clog us up, just like we would have happen if we had a virus on our computer, or maybe we were running maybe we're running too many programs for our operating system and for our memory capacity to handle. So it clogs us up. Yeah.
I was going to say, and when you're talking about clogging up our mind and our body, describe that a little bit better for our audience.
Yes. I was just thinking before you called a little bit about how many joints there are in the body. And each joint, some people say there's 340 to 360 joints in the body. It's hard to explain exactly what everyone means by a joint. Some people mean it's where two bones join and articulate with each other. Some people mean that it means a bone and a gristle or a gristle and a gristle, But in any case, just roughly, 300 to 360 bone joints in the body. Now, each one of those joints has a mechanics, and it has a capsule of some sort, and each one of those joints has a whole array of mechanoreceptors, which sense. They're like your sensors in the engine of your car, And so instead of measuring oil pressure, it'll actually measure pressure inside the joint, tension on the joint ligaments, tension on the joint tendons and muscles. And also we have the capacity to perceive pain when it appears. So when these things happen, there's a tremendous amount of feedback that goes to the brain, and usually that's because there are a lot of these happening at one time, and when that happens, it overwhelms our mental and emotional experience.
And how does that manifest as disease or illness, that kind of thing?
Well, we are pretty commonly known that disease is very much either caused or worsened by stress. So this is the experience of stress. It's a mind-body experience of stress. And so what we will have is usually physically, we could have pain, of course, because the joint gets injured. We could have ligament tears and misalignment of the joints, having bad mechanics, which then fires off a neurological feedback, which is abnormal, causing our muscles to go out of control. We end up with tight muscles and loose and flaccid muscles, deactivated muscles. It can cause a lot of stiffness and weakness and pain. And so, that would be an experience on the physical, would be stiffness, weakness, and pain. On the mental level, what we would experience is that we have a tendency to be less rational, less sane, so to speak. That we're not utilizing our full mental and emotional capacity, so we feel like we're not quite ourselves. A lot of us have, as children, had very expansive experiences of, subtle perception of people and nature, and as we get older and we accumulate all these stresses mentally and emotionally, we begin to lose that sense of fullness of life, that sense of abundance of experience.
And so it sounds like there's quite an intimate relationship between the physical and the joint health and so forth, the neuromuscular health, and our emotional, psychosomatic, so to speak, that whole part of us.
Yes, absolutely. And, just to give you some examples, we've had people come into our office after car wrecks, and the crashes in a car, and then that bangs them all up, and they come in and they're in pain, of course, and they're crying a lot of times, and all bruised up, banged up, and of course, as a chiropractor, if their bones are not broken and they're not bleeding, we treat them, and if usually they've gone to the emergency room otherwise, and so. We began treating people, and they kind of feel like their life is over. They've had a tremendous loss of of their physical, mental, and emotional functioning. And so what we do is we go through a global screening assessment before we even begin treatment, before we even begin diagnosis. And the screening assessment is basically an overall check of all the joints of the body, starting with the upper cervical spine, and then we check the postural distortion that is resultant from the misalignment or the injury of the upper cervical spine. We check everything from ankles, knees, hip sockets, sacroiliac joints, low back, upper back, lower neck, ribs, shoulders, elbows, wrists and hands, and the TMJ joint. And we go through all of that to see really what is the extent of this person's injuries. And a lot of times they're everywhere. Every part of the body can be injured from a car wreck because of the huge forces involved from the weight of the car and, even at a small speed, a 3 or 4, 5,000 pound car generates a lot of force when it collides with your car or with your bicycle or your motorcycle, and if they're moving faster, it can be much, much worse. So what we do is we go through and systematically clear out all those joints, starting with fixing the upper cervical spine first, and then correcting that postural distortion as a result of that correction. Then everything is simplified enough so the body is system, the posture is working well enough so we can get a really good diagnosis on what's going on everywhere else and set a plan and go through and systematically clear out all of those joint misalignments. And when we do that, of course, the pain, resides very, very effectively. But what we also find is the patient begins to see this glimmer, this light at the end of the tunnel fairly quickly. And that gives them this inspiration and this positive experience that starts what I call a healing crisis.
Right.
And so their body starts to repair. And that's largely driven by two things, by the correction of the abnormal joint mechanics so that ligaments can heal and nerves can heal and muscles can rebalance, but also just that very greatly increased positive, upward emotional experience.
So are you treating the physical and the emotional together or individually, one before the other?
Usually we start with a physical. I'm a chiropractor, and I really do the nuts and bolts of the body. That's my focus. But what we find is there's so much trauma tied up in these joint misalignments that when we clear them all out, there's a huge boost in the person's mind and emotions, mental and emotional experience. And also, just from a practical standpoint, this parasympathetic nervous system that we have, that's the other side of our sympathetic nervous system, the autonomic nervous system that underlies our experience, that's everything, runs everything, all the automatic functions of the body, basically. And so, that parasympathetic nervous system gets shut down when the top of the neck and base of the head are misaligned, and when the sacrum is misaligned, because those are the areas from which the central nervous system, where the parasympathetic branch of the autonomic nervous system comes out of the central nervous system and expresses itself into the body.
Right.
When those two things are shut down, which they are in car wrecks almost always, then the person's ability, their parasympathetic functions are impaired. And when the common parasympathetic functions are things like ability to sleep and rest and relax, to digest food, and sexuality. And what I find is that the parasympathetic is very healing also, very nurturing. and it seems to be very much involved in the immune functioning. So when the parasympathetic nervous system is shut down, then the sympathetic nervous system, which is the fight or flight response part of our nervous system, is the one that juices up our adrenal glands and secretes adrenaline into our system and gets us all fired up, to be able to fight or run, basically. That part of the nervous system goes out of control. It takes off. And so it's running because the parasympathetic nervous system isn't there alongside it, working alongside it to keep it in tow. It's kind of like a muscle where you have an agonist and antagonist, where, if you have a strong agonist and a weak antagonist, what will happen is your agonist will really become really rock hard because the antagonist isn't there to inhibit that contraction any longer. So the same thing happens with that balance with the autonomic nervous system.
So the autonomic nervous system is pretty much the connection between the physical and the emotional well-being.
It's a very big part of it, absolutely, very big part of it. I mean, that's the wiring connection, really, I think. The reality is that you can't really look at the wires of the body when we look at, the thinking process. I used to be a modern dancer in New York City, and we studied this book called The Thinking Body. The reality is that our mind is not our brain, and our thinking capacity, it's very dependent upon our brain and our nervous system. But every cell in the body thinks. Every cell in the body remembers. So when we get clobbered by a car crash or a bicycle crash, or we just get, knocked over, playing football or something like that, those impacts, they usually contain a physical experience, an impression that's left on the body, but also a mental and emotional experience and sensory experience of everything that's going on around us. And typically what I find is the more emotional the experience is, the stronger the stress, the harder it grabs on to the physiology and holds on and builds up. So if you look at, for me in football, I was a high school player. There were some major events that happened on the football field, very emotional. Well, I can recall those in great detail, and I'm 66 years old.
Right. So when you work with people neuromuscularly in the joints and work on clearing them, what other systems of the body are affected by their treatment, both negatively and positively?
Well, I can't think of a negative, but I can think of how, I've had patients who couldn't get pregnant, and, we treated them, and then, they've been trying for quite some time and been to all the specialists, and then they got pregnant. I've had people tell me that their energy levels go up, so there's obviously some sort of change in the mitochondria function. There's digestive changes that occur where people, have better digestion. I've had people's vision improve. Oh, there's a really nice one that I enjoy, and that is that people come in and they have high blood pressure that's, this is not a person that's been in a car wreck usually. It's someone who is, actually usually my favorite one is that they don't have any pain, but they have high blood pressure. And we do an evaluation. We find that their upper cervical spine, the base of their head, the first two vertebrae in their neck is misaligned, and we correct that. And in a very short time, just a matter of a week or so, their blood pressure comes to normal. And this is not somebody that has enormous blood pressure, not manic blood pressure, but usually someone who just has, high blood pressure that would respond ordinarily to like 2 blood pressure medications taken simultaneously. They find out about me because I belong to a professional organization called the National Upper Cervical Chiropractic Association. And our group has published a study in a peer-reviewed journal of a project that was done in Chicago with Dr. Marshall Dickold Sr. It was a double-blind study involving chiropractors in the medical community and a hospital, and what 17-point reduction average among 50 subjects, 17-point reduction of systolic, I think a 9-point reduction in diastolic blood pressure across the board. Some of these people had much greater and some less, obviously. I had a guy who had been hit in the head with a crowbar, and of course that injury had all healed, but his blood pressure was really, really high. And I think we said we measured it was a huge reduction in blood pressure just within a few days, and just from correcting that upper cervical spine.
And so
the part of the brainstem, there's a part in your brainstem that regulates blood pressure. And the hypothesis is that if that area is subject to tension or compressive forces or cerebrospinal fluid congestion or whatever happens there when that top part of your neck misaligns, that it impairs that area, it causes it to go out of regulation.
Sure. What are some of the questions I should be asking patients to see if work like you're doing could be helped? What kind of a history do I want to know on these people? Maybe some trauma, but tell me.
Well, the first thing I would look for is a history of accidents, So like I have people who come in and say, well, I have full body pain. I have pain all over my body. Nobody can figure it out. They want to put me on psycho drugs, and, they think I'm just depressed and all that kind of stuff. And I don't really think I am. And I think you can help me. I've been around long enough so people find out about me. And so they come in, and I say, well, have you been in a car wreck? And they say, no. And so then I do my global screening, and their body is a mess. I mean, you can have these joint misalignments with you from you could be 60 years old. You could have been in a car wreck when you were 4, and that stuff is still stuck in your body. And not only that, if it was a really traumatic accident, the experience of the accident is still stuck in your body-mind. And so they come in and they tell me I haven't had an accident, and I do a screening, and I find just a whole list of things wrong. And I say, well, this list of things that I found here, this is just about identical. This is identical to the list that I find after someone has just been in a car wreck and they come to see me to start, getting treatment. And then they think a moment and they say, oh, wait a minute, I was in an accident when I was 4 years old. I was riding with my parents, and, and they go through it. And I say, well, that's probably when this all began. But usually people have more than just one throughout their life. I mean, as I said, people learn to ride bicycles, and they fall off horses, and they crash water skiing. They around here they get into some pretty dramatic snowboard crashes.
Right.
There's just plenty of opportunities. I mean, our bodies are not designed to be crash dummies as much as we would think they would be. I grew up. My health education, what I came away from it was that I was okay as long as I didn't have a fever, and if nothing was broken and I wasn't bleeding.
It's quite amazing how people can hold on to these things for decades.
Yes, and in my work, there's some specifically technical ways of getting these out. I mean, this is all fairly advanced chiropractic I see people who've been to chiropractors all their lives, and they decide to try me, and and then I do my screening, and I present them with a whole list of things that I found that are abnormal with their joint functioning. Mm-hmm. And when that happens, that means they have abnormal nerve function, and then they have abnormal feedback to their brain, and then they have this whole spiraling, big ball of stress that builds up over their lifetime. Right. So, there's ways of doing this, and if you don't do this, then chances are these things will build up. They don't just manipulate themselves out of the joints very well.
And I also suspect that it profoundly affects your immune system, which could, if it's compromised, lead to a lot of other illnesses.
Yeah, and my work a lot involves people with autoimmune problems. And, my way of treating autoimmune problems is kind of different. I clear out the nervous system by fixing all the joints. And then we use a very low carbohydrate way of eating. Right. To reduce the inflammatory and the autoimmune excitatory aspects of the person's food intake. And we get some really great results.
When you take a patient who's had traumas and they're a mess, after you've aligned their joints and healed their nerves and their muscles and really balanced things out, describe what a patient feels like and kind of what you're kind of ended with in treating a patient.
Yeah, what we're really interested in is serving people and the community by increasing people's capacity, as I said, capacity for experience and for function. So increasing ability. And when we talk about that, we're talking about, some pretty philosophical concepts. If you think about it, what we want is a person that's stable. So when we talk about stability, we think in terms of longevity, something that can be fairly permanent. We're looking for something like that, and what we find is that in the way the world operates, to survive, really, you have to progress. In fact, to really survive, you pretty much have to be a genius today. And so, if you're going to overcome all of the economic and environmental and social stress and all the problems that are going on all around you all the time, you have to be highly competent. So what we find is that we really are devoted to helping a person expand their thinking capacity, their feeling capacity, their perceptual ability, their energy, their capacity for coping with the world. And that's really what my work is all about. And of course, one of the real side effects of this type of lifestyle is that you get to be active and you get to be happy.
That's very important. That's a good goal to reach for sure. I have one final question, Tom, and that is, you obviously work with people who've had a lot of traumas and so forth. Do you work with athletes? I know Boulder has a lot of athletes there, high-level athletes, to just help them achieve optimal performance.
Yes, that's one of my more enjoyable things. I mean, I just finished working with doing the first phase of care for a guy that was the running back, or one of the running backs of the 1991 National Championship Colorado Buffalo football team. And I don't know, I think he said he had 15 surgeries over his life from, sports injuries. And he said he'd been in pain for 16 years, I think is what he told me. And he had my cell phone number, or maybe he called the office. It was transferred over to my wife. But anyway, he got me on the phone at night, just sort of out of the middle of nowhere. He phoned and he said, "Dr. Gruver, I just have to share this with you. For the first time in 16 years, I'm totally out of pain." So, his life right now is devoted to helping these high-level athletes, move into their retirement, so that they can deal with this trauma that's been there all their athletic career, and get out of it without pain, and have a quality life afterwards. So there's a lot of that going on. This last summer, seems like it was last summer, yeah. I had the great pleasure of treating a lady that was a member of the tandem cycling team that took 10 hours off the track record of the Race Across America race. So this 10 hours off the record these people were extraordinary. And, it's just a matter of getting everything lined up so they're fully functional, and then monitoring them as they raise the intensity of the workouts, and then keeping them there, keeping everything lined up, keeping everything healthy and developing and growing. We had a guy who had been in neck and back pain for most of his life, and been to a whole bunch of chiropractors. He came to me because of nutritionist referral. He had gone to the nutritionist because he wanted to enter a mountain bike race. And so I treated him, and his problems went away. And then he said, "Now, could you monitor me as I out?" And he went into long riding workouts and weight room workouts, and he used this nutrition work that he had gotten to build himself up. And he entered a difficult mountain bike race. It's the Breckenridge. Wait, is it? No, it's the Telluride 100 mountain bike race. And this is off in mountain trails. And he said he was just delighted that he finished. He finished in plenty of time before the race, timing closed. And so this year, instead of he carried a camelback with water on his back, extra clothes, and I don't know what he had back in there. He brought his cell phone with him. He had a bunch of stuff with him that he didn't need, because he discovered they have these relief stations all along the trail, and you can get water and food. You don't have to bring your food. You don't have to bring your water. You don't need a backpack. And this time he's acquired a trainer. So he's training up, and will probably, I think he's planning on participating next summer. So we're looking forward to that. Worked with a lot of football players, because my son was a college football player for Wyoming, and I became their special consultant for the team, and they sent me their hard to solve or unsolvable cases, and we took care of them in my office. That was a lot of fun.
Very good.
Actually, we got to travel with the team too, so that was great.
Well, it sounds like you're helping a lot of people recover from things that just don't hit the headlines, and making quality of life so much better for not only athletes, but also for people who've been unfortunate enough to have trauma in life, which I imagine is a vast majority of people.
It's almost everyone, yeah.
So, well, good for you, and it's always nice to talk to someone who's got some innovative techniques and is really helping the world out there. I very much appreciate people like yourself, and especially being able to share those experiences and that knowledge to my audience and to others. So,
oh, you're welcome, Dr. Johnson, and it's been a pleasure knowing you over these years. I've always known you as a person who was very innovative and interested in just about everything that had to do with improving a person's health and wellness.
So, thank you so much, and we'll be talking later on, I'm sure.
Excellent. Looking forward to it.
Have a good evening.
Thank you, Dr. Johnson.